Hi, my name is David Konur. I'm the CEO of Cardiovascular Institute of the South, and excited to present today about virtual care and the future of cardiovascular medicine. I'd like to thank Dr. Walker and the entire team at NCVH for putting together this digital series. I think it's just phenomenal given all that's going on. I have no disclosures, but talking about all that's going on, it's hard to talk about virtual care anymore without talking about COVID-19 and what it's done for the virtual care environment, for telemedicine, for changing the way that we fundamentally practice cardiology. When this was a particular headline I liked, that the first step is to return to a fundamental premise that the needs of our patients must always come first, something that we've always believed at CIS. It's central to our mission of providing our patients with the highest quality cardiovascular care available. But certainly the pandemic, there's a silver lining in that, it really has pushed virtual care to the forefront. Telehealth will become a norm for taking care of patients now. One of the headlines reads, pandemic benefit, the expansion of telemedicine. This was really critical. Telemedicine was just critical for taking care of patients as we got into the first wave of the pandemic. This is looking at Louisiana's 7-day moving average of new cases. And when we go back to early or mid-March, I should say, Louisiana was one of the first states that had just a real big, fast rise in cases, mostly due to Mardi Gras. And so as our governor shut down our state and the State Board of Medical Examiners started limiting cases that could be done at hospitals, patients were scared to come in. How were we going to connect with those patients? And luckily, CMS acted quite quickly in recognizing that telemedicine and virtual care were a great avenue for providers to connect with patients. And so as providers across the country were forced into telemedicine, one of the nice things for us at CIS was we've been in virtual care and in telemedicine for over 5 years now. But, even for us, there were challenges. Our core telemedicine team is comprised of about 14 physicians that take telemedicine call at rural hospitals. And now all of a sudden we had to get all 65 physicians and 45 nurse practitioners on our telemedicine platform. But luckily we had the infrastructure already in place. And this is looking at our data, and if you look at weeks 3 and 4, this is 2 week. Each bar represents 2 weeks of data. You go back to weeks March 16th through the 27th. That was our first drop in number of visits. We tend to average about a little over 1,000 patients a day at CIS. So in 2 weeks, we average a little more than 10,000 patients. So you can see we dropped about 40% at the height of the first wave. And that actually was nowhere near as bad as many of my counterparts in other groups who dropped much further than that. The orange bar represents our virtual visits. So over 50% of our visits were done virtually. In fact, in 60 days, we did over 11,000 virtual visits. What also happened, patients struggled with access to care in many places. And again, we were lucky to have a virtual care center in place that staffed 24 hours a day, 7 days a week. And the increase in access by patients between 20 and 35% was not insignificant and remains higher than usual now as we're just coming out of the second wave. But for us, virtual care started as a service strategy, reducing the friction in healthcare, and in doing that by standing in the shoes of the patients and improving access and improving support to our clinics. Our mantra when we created this was that the virtual care center will transform healthcare by connecting specialists with innovative technology to increase access and provide the highest quality cardiovascular care available. We were trying to reimagine the delivery of cardiovascular care and reframing how it's delivered. We touch a patient every minute of every day in our virtual care center, and just a couple of pictures of what it looks like inside. I think another important point is that physicians and hospitals alike rarely invest in innovation until there's a proven payer source. We chose to invest in it, seeing that we had to do things different if we were going to maintain and continue to be a high quality, lower cost provider in our communities. So our journey into virtual care, like I said, started about 5 years ago, 2015. Where we are today is in a very different place, a comprehensive virtual care center, where we not only support our clinics and do our telecardiology, but we also do a tremendous amount of rhythm management through our virtual care center. Our bundled payment program is run through our virtual care center. Chronic care management, PCM, TCM, now run through our virtual care center. Remote Coumadin monitoring, Nocturnal Call for our hospital partners, virtual visits, and from all that, we get a tremendous amount of business intelligence that allows us to continue to improve our processes. The advisory board featured us back in the fall of 2018, and one of the things they noted was that we spent $7 million in the 3 years between 15 and 18 creating the virtual care center. So it wasn't a insignificant cost to do this, but the return has been amazing, and amazing from a patient care perspective. A 90% reduction in the time to respond to patient problems is one of the ones I'm most proud of. When we look at the clinic support services, what does that include? That includes 24/7 nursing and nurse practitioner access for our patients, prescription refills, prior authorizations, patient problem resolutions, pre-surgical clearances, and we can certainly make appointments from the VCC as well. Like I said earlier, we see about 30,000 patient touches every month. 72% of those are handled through the VCC, and patient problem resolution less than 30 to 60 minutes. 98% of our prescriptions are refilled through the VCC, or 75% of our prior authorizations, and 65% of our surgical clearances. Our Cardio at Home program, which is chronic care management, PCM, RPM, that is run through the virtual care center, now has over 2,000 patients with chronic conditions that are managed through virtual care. Our bundled payment program, we participate in inpatient and outpatient PCI bundles, started that in October of 18. And again, we're leveraging our Cardio at Home team to reduce things like readmission, to improve patient outcomes. And for us, we're realizing the $1.5 million opportunity that came from volunteering to participate in the CMS bundle payment program. Coumadin remote Coumadin monitoring. We've been able to reduce the number of Coumadin patients from 3,000 to 1,800 in our practice, and at the same time be able to increase substantially the patients in therapeutic range, which is now we're keeping them in therapeutic range 80% of the time. Our Nocturnal Call program, when you look at physician burnout, 43% of cardiologists are reporting burnout, and we actually think that number is higher than 43%. So we have had nurse practitioners take first call for quite a long time. But at the same time, we were seeing a burnout of our nurse practitioners. So now for 7 of our hospital partners, actually 8, we just added an 8th one. We are now providing first call remotely through the virtual care center, which is great because we have an awake and alert nurse practitioner who's taking that first call, managing care at multiple sites, and again, gathering data and analytics that allows us to improve that service. Telecardiology has been big. We've been in telecardiology now for over 5 years. Last year, we did 2,000 telecardiology visits. 900 of them were in rural hospitals. This year, due to the pandemic, we're now at 15,000 telecardiology visits. 98% of our patients are completely satisfied with that service. And one of the great things, again, for rural hospitals is it gives them access to cardiology 24 hours a day. And they didn't have that before. And as a result, 84% of the patients stay in the hospital or are discharged home, and only 16% of the hospitals of the patients are transferred. Whereas in the past, if you came in with chest pains or difficulty in breathing into a rural access hospital, you were automatically transferred. And so again, it's taking waste out of the system and providing a higher level of care for the patients, which they greatly appreciate. Rhythm management has really been a tremendous win in the virtual care center. 9,500 patients have device implants in our practice, and we've been able to improve the compliance to the quarterly visits with them to 97%. That's where we are quarter to date. On top of it, this last year, we started mobile cardiac telemetry. And now in any given month, we'll have 450 to 500 patients being monitored around the clock through our virtual care center. And lastly, the virtual care center gives us a tremendous amount of business intelligence. And again, that allows us to continue to improve our processes, enhance the quality of care, and make a difference in the lives of each and every one of our patients. As a result, patients have responded, and in the last 3 years, we've been the #1 provider in patient satisfaction, as measured in the NRC database with organizations that have 50 to 100 providers, something that we're incredibly proud of. And so, again, this one of the silver linings in the COVID-19 pandemic is that it has shone a light on virtual care, on telehealth, something we've been doing for the last 5 years. And now we're seeing people really understand the value that it brings. And patients absolutely love that flexibility. And so we're excited about where the future is going to go with this. And we are certainly all in.